today. We are in a brand new section when it comes to anatomy. How about that? I find that pretty exciting. So I get to welcome you all to the section of the abdomen. We just finished off the thorax, so the abdomen's going to carry a lot of our digestive infrastructure, which is very, very important. Some of you have a love-hate relationship with your GI system, maybe because you don't get along with dairy or what have you, but very, 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 very important. All the systems in our body work together for us to function and have us carry about our day-to-day lives. So, as always, if you like these videos, please leave a like. If you've been watching quite a few and you enjoy what I'm putting out, I'd love it if you'd subscribe or share with a friend that you know loves ASMR too. As you can see, the beginning sections here for the abdomen, or the sections are surface anatomy, which we'll go over, and then we'll get through some of the abdominal wall today. And then we've got the abdominal cavity and spaces, internal organs, neurovasculature, and then the sectional and radiographic anatomy as per usual. I guess just a quick disclaimer on this. I double-checked YouTube's policy for content, and there are some anatomically represented aspects of the body that, may not want to put it out there necessarily for kids to see. I mean, it's for educational purposes, so YouTube can censor it, but I do still want to provide a disclaimer just in the event you're ever watching with your kids in the room or anything like that, and you don't want to have a conversation about about privates or about things that are typically covered up. So, not trying to be prude, but I'm trying to be polite and at least give everybody the disclaimer and the awareness of what's to come. So, with that disclaimer and the typical information covered out of the way, let's get started. Alright, so we've got surface anatomy. And here in figure 12.1, we've got palpable structures of the abdomen and pelvis. And up here in the upper left-hand corner, the ASIS is sometimes called for short. That's the anterior superior iliac spine. So it's at the front, it's on the top, and it's the spine of the ilium, which is one of your major hip bones. We've got the inguinal ligament that runs through here, and then right here in the middle is the pubic symphysis, and that's the juncture of where your two pubic bones, one on each side, meet. And we'll get into the whole pelvic girdle later, but this whole structure, these series of bones that connect to each other, that support your lower body, that's going to be it's commonly called your pelvic girdle. Now getting over here, continuing with the bony prominences, we've got the pubic tubercle, which is a bony process that's palpable, typically right around your genital region. And then the transumbilical plane, which is at L3, L4, right through here. It's just kind of an orienting purposes. Over here, musculature that's likely palpable. Could be, depending a little bit on body mass, but still. We've got the rectus abdominis right here, the tendinous intersections, and that's what causes the definition for the individual abdominal muscles, for those of you who have them easily visible. The SIS again, and that is just to acquaint us, and it's actually an attachment point for the sartorius, which is kind of like a sash-like muscle that runs through here. Got the quadriceps femoris, and then up here we've got the superficial inguinal ring, and that's an important portion for in men for some of the structures that pass through to the male reproductive organs. We've got the semilunar line here, and the linea alba here, and we don't typically even know that this is here, but there are instances, especially for late pregnancy women, sometimes that line will actually become physically visible as like a dark brown line on the abdomen, which is kind of cool. It just, everything gets pushed so far out during pregnancy that suddenly becomes visible. All right. Now, when it comes to the abdomen, quadrants are very important because whenever you experience pain in a region of the abdomen, there's so much packed into a small amount of space that it's helpful to break it down by quadrant so that you can very quickly run a differential diagnosis based on what's in the area. So here's our anterior view, and the locations of the organs of the abdomen and pelvis can be described by the quadrant in the layer. So here's your right upper quadrant, RUQ for shorthand notation, right lower quadrant, RLQ. Here's the costal margin, here's the left upper quadrant, LUQ, and the left lower quadrant, LLQ. And then the peri-umbilical region is kind of, if you wanted to treat this like a target or a crosshairs, this is the bullseye right here. So the quadrants defined by the intersection of the median plane and that transumbilical plane, which we talked about up here, L304. So that's your divide, your horizontal. Yes, your equator of the quadrants running horizontally. The organs of the anterior layer. So this puts them in approximation to the quadrants, and I think it's lost sometimes just how high up the liver is. So the liver is up here in the right upper quadrant. The stomach is going to be in the left upper quadrant. You've got the transverse colon running between both of the upper quadrants, and then the small intestine, which is composed of 3 different portions. A large part of that actually is going to run in the lower 2 quadrants. And then continuing on, behind these structures are additional organ structures. So they're calling this the anterior layer. This will be in the middle layer and the posterior layer. So we're at the front and we're working our way back through the 4 quadrants. So the gallbladder is going to be in the right upper quadrant. The spleen is going to run between the upper quadrants. The pancreas is going to hang out here in the left upper quadrant. The duodenum, which is, let me see here, that's going to be the upper portion of your small intestine up here. And then, what else? Oh, yeah, so in the middle portion, the ascending colon and the cecum and the variform appendix. So basically, the right and left half of your colon are going to be visible in this middle layer, and the descending colon is the kind of the final path for all the waste products that you'll be excreting out. And then the organs of the posterior layer, so the very back, pretty much almost on the back, you've got the suprarenal glands, which are sitting on top of the kidneys. The abdominal aorta is, as you know from the last section, pretty much laying right in front of the spine. And then the ureters coming off of the kidneys, leading down eventually to the urinary bladder and then to the urethra to be excreted out of the body for the liquid waste products. All right, so now we've got transverse planes through the abdomen. So here we've got the transpyloric plane. That's 1. That's a transverse plane midway between the superior borders of the pubic symphysis and the manubrium. 2. The subcostal plane. That's a plane at the lowest level of the costal margin, or the inferior margin of the 10th costal cartilage. So basically where your 10th rib is sitting at before your floating ribs, that's going to be the level of the subcostal, which makes sense. Costal means relating to the ribs. Subcostal, so it's just below that. The supracrestal plane at 3. The plane passing through the summits of the iliac crests. So that makes a lot of sense. Here's your iliac crest on both sides. It's right on top of it. The transtubercular plane for number 4. It's a plane at the level of the iliac tubercles, and a tubercle is basically a palpable process or an outcropping or something that sticks out off of the bone, and it's palpable or easily identifiable on radiographic imaging. So it says the iliac tubercles lie 5 centimeters posterior lateral to the anterior superior iliac spine. So that ASIS that we already talked about. So it's back and lateral of that spine. So back and down. And then the interspine is plane. The plane at the level of the anterior superior iliac spines. Okay. So, yeah, there's, let me see. Yeah, that's right. And then the regions of the abdomen. So it's breaking it down even further. So you've got your quadrants for quick reference, but then there's actual regions of the abdomen. To dial down a little bit further, I would say, anybody who's practicing a day in and day out can correct me, but my impression has always been that the quadrants are for quick diagnostic reference, and then the regions of the abdomen are for study and classification and things like that. If I'm wrong, please tell me. Please leave a comment. I want everybody to leave these videos relaxed and informed, not stressed because they've been misinformed. But up here in the middle, epigastric region, which makes sense. Epi is above the stomach. Epigastric region, umbilical region, pretty self-explanatory. Umbilical, that's where your umbilical cord once was. Pubic region, pretty straightforward. Left hypochondriac region, 4. 5 is going to be left lateral lumbar, left lateral region or lumbar region. Left inguinal region, because again, that inguinal ligament. And then pretty much mirroring right hypochondriac, right lateral or lumbar, and right inguinal. Okay, so we got the bony framework for the abdominal wall. Anterior view. So these bones are the site of attachment for muscles and ligaments of the anterior lateral abdominal wall and form a bony cage that protects certain abdominal organs, which again we already covered with how high up the liver and the spleen both are. And despite all this coverage, that still sometimes isn't enough. That's just how it happens. Okay, so we've covered most of these upper features already, but I'll highlight a few of these in the lower portion that I don't feel like we've gone through already. And you remember the transverse processes from when we did the spinal unit. But we've got the wing or the ala of the ilium, the iliac tuberosity, the sacral promontory, the arcuate line, the ischial spine, the ASIS again, the iliopubic eminence, the superior pubic ramus, the pubic tubercle, the pubic symphysis, and then the sacrum itself. And we'll get into it, but there's the ilium, the ischium, and the pubic bone. We may even get into it right here. So here are the ligaments, and this is in a male pelvis anterior superior view. And the reason that it's specifying the male pelvis is because the orientation of the hip bones between men and women is a little bit different. For men, it is a little bit more narrow, whereas for women, insertions are in blue. So again, just a reminder from what we talked about before. Origin is where it starts, insertion is where it finishes. Typically, I think, yeah, every time, the insertion is going to pull back towards the origin. That's the contractility of the muscle fibers, the directionality, the functional directionality. So the quadratus lumborum, which is a huge muscle, attaches up here. Transversus abdominis attaches here. Internal oblique here. External oblique's insertion is here. Psoas minor insertion here. Origins of the rectus abdominis, the pyramidalis, the rectus abdominis, and then more origins. We've got quadratus lumborum, and this is just kind of a tilted orientation. So this is a superior view, this is a medial view. Transversus abdominis can be seen here, and psoas minor. That almost feels like a redundant view, but I guess they are highlighting just the way that those muscle relationships. Okay, muscles of the anterior lateral abdominal wall. So we've talked about the origins and the insertions, but now we can get into the muscles themselves and seeing it in actual, with true representation. So the oblique muscles of the anterior lateral abdominal wall consist of the external and internal obliques and the transversus abdominis. The posterior or deep abdominal wall muscles, notably the psoas major, are functionally hip muscles, which is an interesting note. So we've got the pec major, so we're up in the chest, up here the sternocostal portion. Here's the sternum, serratus anterior, which is part of your lat support. Abdominal portion of the pec major. Here's your external oblique, the aponeurosis, that kind of what's the word? Fascia. That was the word escaped me for a second. Here's the rectus sheath, the anterior layer. There's that inguinal ligament again. Here's the superficial inguinal ring, and then in that ring there's the suprametachord and the cremaster muscle, which we'll get into more with some of the male genitalia. Here is the fundiform ligament of the penis. Here, linea alba again, umbilicus again. Internal intercostals of the ribs, costal cartilage, the sternum. Yeah. Let's see. What are we highlighting that's different? Now we can see the internal oblique. The internal oblique aponeurosis, so another fascial layer under this fascial layer. And, yeah, we can down here see the rectus sheath, the interior layer. We can see the tendinosis intersections here of the abs, from that abdominal separation. External, internal oblique, and now we're going one layer deeper with the transversus abdominis. And then there's an aponeurosis for that too. And then there's that pyramidalis muscle that we saw the insertion for on the previous page. We've got an arcuate line here. Here's a deep inguinal ring. So here's the superficial inguinal ring, and then we've got a deep one as well, just down the way a little bit. And then, what else is different? Here's transversalis fascia. And then I think the last thing we'll go through here is the muscles of the posterior abdominal wall and diaphragm. So we're basically building off of the end of the thorax. We basically went down to the level of the diaphragm, maybe a little bit lower, but we're on the inside here. So that's the transversus abdominis, which is the innermost. Rectus sheath, posterior layer, the iliacus muscle. We can actually see from this picture, from this orientation, the obturator internus muscle. Here's the pubic symphysis again for orientation. And this is a mid-sagittal section, so this is our patient cut in half. Here's a piriformis, which is an important muscle we'll talk about. has all the branching vasculature that comes out and gives oxygenated blood to all these organ structures. Quadratus lumborum, a huge muscle of the back. Psoas minor, an important muscle of the back. Psoas major. These are all right through here. These are huge lumbar muscles. The iliacus is here. Here's again that transversus abdominis. And the iliopsoas here, down here, is important. And this is a coronal section, so patient turned to the side and cut in half. Coronal section, patient facing us, cut in half. And then it's really diving into the coronal section of the diaphragm in the intermediate position here. So you remember the Kurios, right and left. Aortic hiatus again, esophageal hiatus, like the caval opening up here, all having to pass through the central tendon of the diaphragm. And then we've got the lateral arcuate ligament. And so we've got lateral and medial arcuate ligaments. And there's the quadratus lumborum again, and the psoas major again. So those running in relationship with each other is very important, which we'll get to. Diaphragm in C2, the diaphragm which separates the thorax from the abdomen. So again, basically where we stopped last time was about this line right here. Has 2 asymmetric domes and 3 apertures for the aorta, vena cava, and the esophagus, which we saw. So vena cava, esophagus, and aorta. Those are the apertures it's talking about. And then there's for the vena cava, for the, where's it at? That's the esophageal. And then the aortic is, further down right here. The diaphragm, so it's got the, it says that the 2 asymmetric domes and 3 apertures. So here's one portion, and then here's kind of the other portion over here. And it's actually helpfully showing us that we're at the level of T8. So T8 is pretty much where your diaphragm lies. And then this is an inferior view. So we'll go ahead and go through it because it's got a few pieces, a few aspects of musculature that we probably wouldn't be able to see otherwise. Another triangle. I know we joke about them, but another triangle. Lumbocostal triangle, which is Bojdelec's triangle. So if you discover a triangle in anatomy, you can get your name in the anatomy book. Lat dorsi here. Intrinsic back muscles. Let's see, there's the psoas major again, which means that the quadratus lumborum is going to be nearby, and the psoas minor is going to be nearby too, but I don't think they'll let us see it in this picture. And then again, to go through those ab muscles, or part of the ab muscles, we've got the external oblique, and then the internal oblique running inside of that. And then when it comes to the, so those are more core muscles, the ab muscles, we can see the rectus abdominis here. And so this is for people who love tables, for the diaphragm, there the costal part, the origin is the 7th to the 12th ribs. The lumbar part, the origin for the medial part is L1 through L3, the intervertebral discs, and the anterior longitudinal ligament as the right and left crura. Lateral parts are the lateral and medial arcuate ligaments, and then the sternal portion has the xiphoid process, or the posterior surface of it. They all carry the same insertion, which is the central tendon, and they all, so basically what it's telling us is that from all these different points, they're coming to insert into the central tendon. So it's kind of an anchor here in the middle of your body. The innervation obviously has the phrenic nerve going through it, and it has the root in C3 through C5 of the cervical plexus, which we will get to eventually. And the action is the principal muscle of respiration, both diaphragmatic and thoracic breathing, meaning forced breathing and the breathing you don't think about. And it also aids in compressing the abdominal Nice and